to you. They've been crisscrossing the country, getting the nation to bear all.
It's humiliating. People pointing, staring, trying to touch me.
Not content with teaching us a lesson, they've been taking a dose of their own medicine.
I'm a really bad patient.
From foot to mouth, tooth to nail, nothing has been too below the belt. Remember, there's no shame, we're all the same. Coming up, have you brought back more than you bargained for from your holiday abroad?
It looks to me like you've been bitten by bedbugs.
There are some things you just can't stop.
Just been travelling with a guy who did 23 poos in one day.
And sadly, some who just can't go.
I'm not going to the toilet for sort of 12, 14 days at a time.
And there's one man who wished he'd stayed at home.
I do wish I'd never gone on that holiday for the simple reason that it's ruined my life.
Holiday heaven can quite literally become a holiday health nightmare. So today we've decided to take our truck and clinic to where the horror story begins and returns, the airport. If it's a quick local jaunt to Glasgow...
Are you going to catch any illnesses or any diseases when you go to Glasgow?
No, it's very civilised, really.
Is it?
Or a stag night to Amsterdam.
Say, what are you going for? Fun? Sex. You need some of these.
You need to be prepared.
You've got an energy drink, unrefrigerated meat, and I'm here talking about infections. Good lads, some toothpaste.
Whether they are going or coming back, the doctors have set up a temporary drop-in clinic so travellers can get rid of any troublesome baggage. Joanne is worried her condition is not helping customer relations.
So what's worrying you?
My osteoarthritis. As you can see, it's horrible.
It's quite extensive, isn't it?
Yeah.
What are the main problems you get from it? Is it embarrassment because people see it, or does it feel nice?
Both. I'm embarrassed by people because I do see people looking at it when I've got my jacket off.
What are you doing for it at the moment?
I have been putting baby oil in my bath, which helps, but the cream that the doctors have given me is so thick and greasy, and it's that coal tar style cream, and it's really smelly and horrible, and it stains as well.
The main treatment for psoriasis is emollients.
Emollients,
So
yeah.
moisturisers, moisture. The other thing is steroid creams. When you've got a flare-up and it's bad, you can slap the steroid cream on. You'll never cure it.
No.
But you can sort of hold it back a little bit and stop it being quite so miserable for you and stop you feeling so self-conscious.
Red raw rashes seem to be the rage, and Donna brings us one she's had under wraps for a while.
There's just this patch here.
Yeah, it was a lot worse than that.
Right.
It went black and then it scabbed over.
If you had chicken pox...
Well, when I was a kid, yeah.
When you're a kid,
Yeah.
right, okay. I think that's probably shingles. You're now recovering from it. But very typically with shingles, you'll get really bad pain,
Yeah.
what we call neuropathic pain, which is basically a nerve pain. If you're managing now,
Yeah.
then it's unlikely that the pain will get, it's going to get more severe. All right? Yeah.
Shingles is a reactivation of the virus infection that causes chickenpox. For some reason, often many years later, the virus travels back down one of the nerves to the skin, where it causes a rash in the area of skin supplied by that nerve. Remember, you can't catch shingles, but you can catch chickenpox from someone with shingles if you've never had the infection. Next in is Arfan, who's had an accident that's left him with a condition he's trying to get to grips with.
I've just come to show you my finger, which was damaged in an accident at a factory. It was like a 18-stone copper coil fell on it, basically.
So something crushed it?
Crushed it, yes. Went to the accident hospital in Birmingham, and they removed it. But unfortunately, that didn't work.
Yeah.
I have to file it down, for which I have to use industrial file and sandpaper.
Right. You've got a real talon-like nail coming out here. It's a condition that we call onychogryphosis, and this is purely as a result of injury. I'm going to be absolutely straight with you. I don't think this is going to change. I would say that the only thing you can probably do now is consider having the whole nail taken out again. Hopefully, it might start growing back normally, or it won't grow back at all, and you'll be left with no nail, or it'll just carry on growing like this gradually when it comes back. And I can't tell you which one is going to happen, so you have to decide how much is this bothering you, and are you prepared to take that risk?
Back Back at Embarrassing Bodies HQ, Stuart can't wait to see her doctors. He blames a holiday abroad for picking up his condition that's left him in constant pain.
It's had a dramatic effect on my life. In my life at the moment, it's on hold, because one day I can be having a good day, then the next day I'm just laid up in excruciating pain. And at my age, at 44, I don't want the rest of my life with this. I want to get rid of it.
Hi there, how are you?
Yeah, nice
I'm
to see you.
Pixie. Take a seat there.
Thank you.
Now, how are you doing?
Struggling.
Struggling, what's the problem?
Yeah, to be honest, I've had a problem for about the last 4 or 5 months. I came back after a week's holiday from Mallorca, and since then, my symptoms are getting worse day by day, week by week. Reference to constant burning at the end of my penis, and I'm struggling to pass water all the time.
So how often are you going?
On a bad day, anything up to about between 20 and 30 times a day and go to the toilet.
Crikey.
You constantly feel, as soon as you come away from the toilet, I walk back to the bed, and before I even got back to the bed, I think, I haven't finished, I've got to go back.
Right.
So I go back to the toilet, and I end up sitting down now all the time. Sometimes I've nearly fell asleep sitting on the toilet.
God.
Yeah, so.
All the things you're describing all say to me, prostate.
Yeah.
What I think would be a good idea is if we could just do an examination just to make sure that there isn't anything sinister going on in your prostate.
Okay.
What I'm going to do is I'm just going to examine your prostate gland. Unfortunately, as I'm sure you know, your prostate hides up the back passage.
Yeah.
All right?
Okay.
If you just stay where you are on your left side,
Yeah.
all right?
Yeah.
Okay. Is that uncomfortable?
Yeah, slightly.
Yeah. Okay. Perfect. So no huge deal.
Okay.
All right?
Yeah.
You want to dress yourself up and pop your bits on again.
Okay, thank you.
Okay. Your prostate examination shows that your prostate is very, very smooth, probably slightly enlarged for a man of your age, but certainly nothing suspicious up there. I'm not worried that you've got anything like a prostate cancer or anything like that. It sounds like it may well be something like prostatitis, which is inflammation of the prostate gland.
The prostate is a gland shaped a bit like a donut encasing the urinary pipe. When it becomes inflamed or infected, it puts pressure on the tubing, which makes it painful to pee. There are many causes of prostatitis, not all of which are known, but the main ones are a bladder infection that spreads to the prostate, a sexually transmitted infection, and stress is also thought to be a factor.
It can take months and months and months and months to treat.
Don't I know it?
The thing is to be on the appropriate antibiotic. There is another treatment which is used for prostatitis, which is actually massaging the prostate gland. And there's very good clinical evidence to show that that improves the symptoms of prostatitis.
I'd be willing to try that, yeah.
So we shall get that sorted for you.
Thank you very much.
And hopefully you'll be back on track.
Okay, cheers.
All right.
While it is possible to get prostatitis anywhere, Stuart believes his case started on holiday.
I do wish I'd never gone on that holiday, for the simple reason that it's ruined my life.
Coming up, we're talking the most embarrassing traveller's condition.
Laid up for about 3 days.
It was liquid diarrhea.
Yeah.
Couldn't control it.
Couldn't control it.
Yet for one lady, just being able to go would be a relief.
It just feels like I can't. It feels like nothing's working.
And bacteria using your mouth as a house, and your mucky paws to spread spores.
I'm interested in bugs that might be travelling on your hands.
Pack your bags, we're on a voyage of prostate discovery.
That's his prostate.
We're exploring the hidden recesses of your gums. And we answer the question, the further you go, the more germs you stow.
Are you going to have a go as well?
At Birmingham Airport, there's one traveller's illness that everyone seems to have had a bitter experience of.
Seems to be that the most common thing people are catching is diarrhea. Lasts for a few days and can really spoil their holidays.
Squirts,
runs,
cramps.
Of the 7 million British travellers who fall ill each year on holiday, 80% are stomach-related cases. Yet less than half of us pack anti-diarrhea treatments.
Have you brought any medical stuff with you just in case anything goes wrong or you become ill or...?
No, I haven't.
Nothing? No? Just go with the flow and take what happens.
Hope for the best.
How about yourself?
No, not really, no.
The main culprits causing diarrhea are viruses and bacteria that are not normally found on our skin. These are known as transients. This one, called enterotoxin-forming E. coli, is responsible for 40% of diarrhoeas caught on holiday.
We've just been travelling with a guy who did 23 poos in one day.
Laid up for about 3 days.
It was liquid diarrhea.
Yeah.
Couldn't control it.
Couldn't control it.
The question is, if we're travelling, are we likely to come into contact with more bacteria?
We're going to check out a random sample of returning travellers to find out.
Go for it, right in the middle.
We're using agar jelly in Petri dishes to see if these travellers have anything more exotic at their fingertips.
I'm interested in bugs that might be travelling on your hands. Are you going to have a go as well? Here we go. Perfect.
The samples are sent to our microbiologist, Professor Val Edwards-Jones, where they are given warmth and moisture to grow.
We've got people here from all over the world. We've got them from long-haul flights, short-haul flights. Now, that person's come from an international destination. Just look how many bacteria they have on the fingertips.
But does it make a difference where you go?
This one is a woman from a local destination. Found a whole range of microorganisms you'd find on your bottom. And these bacteria here are the ones you'd normally find in the gut. I think basically what it shows is that no matter where you come from, you should wash your hands.
1 in 6 adults in the UK admit they don't wash their hands every time they go to the loo. And 50% fail to dry their hands properly, creating the perfect moist environment for bacteria to multiply. If we cleaned up our act, up to half of all acute respiratory and stomach-related infections could be prevented. Kerry is at her wit's end. She's already had 3 operations to correct her problem, but to no avail. She's desperate to find a solution.
Sitting down for a long time can be painful. Standing up for a long time can be painful. I'm just fed up with it. I just feel like I'm going round and round in circles. Nothing's getting any better. To get through every day with no pain would be lovely, really nice.
Kerry.
Hello.
I'm Christian. Hi, nice to meet you. Come and have a seat for me. So, tell me what the problem is.
I had a baby just under a year ago, and a week after having her, I started to get pain when opening my bowels and bleeding. Felt like everything was tearing down there.
So what's the main problem now?
Not going to the toilet for sort of 12, 14 days at a time.
Really, that long?
Just because the muscles it just feels like I can't do anything, I can't.
When did you last have a poo?
The last time was probably about 5 days ago.
Do you bleed?
Yeah.
You do? Every time?
Every time, yeah.
How do you know when you want to go to the loo?
Because the stomach cramps get really bad. It feels like nothing's working.
So I think the best thing now is that I have a look and see what's going on, see if there's any defects in the muscle that I can feel, see if there's a little tear.
Okay.
All right, just squeeze on my finger for me. Good, and relax. And then do it again. Is it sore around here?
Yeah.
And here? You are quite tender there, aren't you?
That is.
Okay, just squeeze my finger again. And relax. Okay, I think you probably have had a little tear because you now got a bit of loose skin, like a skin tag, and you often see that form after tears. There may be a little bit more going on inside as well, and I think we should send you to a specialist in that area of your anatomy who can do a few further tests on the muscle and give us some more of a clue about what's going on. And that way, we can come up with a plan to help you. Will that make you happy?
Yeah, definitely.
Yeah?
Lindsay knows beauty is only skin deep, but she would still like to get her problem off her chest.
As I've got older, I've become more embarrassed about it. When you're younger, I suppose you're not really too bothered. And because it's become bigger, it's hard to cover up. Now, if you apply any pressure to it, it can get quite sensitive, or if you catch it, it is quite sore.
Hello there.
Hello.
I'm Pixie.
Nice to meet you.
Take a seat. Now, how are you today?
I'm fine, thank you.
What can I do for you?
Well, just got a scar on my chest. And I've just come today to basically see if there's any treatment that can be done to either get rid of it or to make it smaller. Just exploring the options, really.
How long has it been there for?
I've had it since I was about 7 years old, so probably about 16 years.
How did it start?
It may have just started from something as small as like an insect bite or a spot, and then over the years it's just gradually become bigger.
Can I take a look?
Yeah, of course.
Can I pop your hair back because you're doing a bit of camouflage there, aren't you? I mean, that is a keloid scar where you get very, very thickened scar.
Yeah.
Much more common in Afro-Caribbean skin, actually.
Yeah.
Quite firm, isn't it? It's quite...
Yeah, it's quite like rubbery.
Yeah. I mean, it's thick. God, it's a couple of millimetres thick, isn't it?
Yeah.
Do you find people actually look at it?
People have asked me things like, is it a third nipple? I just have to explain what it is, but people are just, because they're unsure, that it makes them ask questions.
Classic site here, face, back of neck and back.
Right.
Which is why I say to patients a lot of time when they come in with an innocent looking mole that they want taken off their front décolletage basically, so here, or their back, unless you really, you know, unless it's clinically indicated, don't, because you could end up with a scar bigger than what's there. I think the best way to approach this, Lindsay, is probably with steroid injections. So that would be injecting steroid under the skin, what we call subcutaneously, and trying to shrink down that scar.
Okay.
Get rid of some of the redness and the thickness and shrink down the diameter of it as well.
Right, okay.
It's a big scar, so you might need some laser treatment to the area afterwards as well, just to get rid of any surrounding pigment.
Right,
so it's probably a twofold treatment and certainly a series of treatments. I think in Lindsay's case, steroid injections are the most sensible way forward. Yes, they do have side effects, but I think the side effects of surgery may induce a far greater scar and far greater complications than she already has.
Each week, Dr. James, our dentist, has been discovering more about the state of Britain's mouth, unearthing the rot that's set in. Jessica's condition is one that people often laugh at, but it can become a serious problem leading to social isolation and severe depression.
I've noticed how people have reacted towards me, like pulling away, making comments behind my back, and I feel really embarrassed, like I don't want to open my mouth and speak. I try to talk with my mouth like this, closed, or with my hands over my mouth.
Mysteriously, she has magnificent molars, so why is she here?
So, how can I help you today? What's your problem?
Well, I've been suffering with bad breath.
How long do you feel the bad breath's been going on for?
It's been going on for years.
When you're brushing or flossing, do you still find you get any bleeding of the gums?
Yes, I've noticed I get a lot of bleeding, especially my lower and the top when I floss. Okay. And then my tongue would bleed a lot because I would literally be scraping with the tongue.
Stick your tongue right out for me. You do have slightly increased papillae, which is the little sort of hairy bits on the tongue there. I think some of the whiteness is almost a sign of the trauma that you've been doing to the tongue. And whilst a little bit of gentle tongue scraping is okay, I think you've probably been going over the top a little bit just because you're worried about, you know, the bad breath bit.
Jessica has been blaming her tongue for her bad breath, and in many cases, tongues can be great health indicators. A pink, flat, shiny tongue can indicate iron deficiency. Black and hairy can be an overgrowth of bacteria, and a white cheesecake covering can be a sign of oral thrush. So if you're worried, don't bite your tongue, bring it up with your dentist. So if it's not the tongue, what is it? Bad breath can be a symptom of something far more serious.
Keeping really nice and still.
But James works his detective magic, and the answer is elementary.
And I think the really great thing is that overall, your mouth looks to be in good health. Now, when we're probing around the gums, we've got some of that bleeding, that's a definite sign of inflammation. And before we think about any other causes for your bad breath, I want to eliminate that as a possibility first of all.
Jessica goes to a dental hygienist whose tools will get to the parts most toothbrushes cannot reach. Jessica's swollen gums have created pockets in which tartar and plaque have moved in. 70% of us do not brush our teeth for a full 2 minutes, so are more likely to have the same unwelcome bacteria who come in, make themselves at home, eat our food, and then defecate in our mouths. This, in effect, is the classic bad breath smell. 3 weeks later, she's back to see James.
Well, really what we do now is having a look to see how healthy the gums look from a sort of purely observational point of view. But now what I want to do is just have a little feel around the gums with our probe and just see really if we can stimulate any bleeding or anything like that, just with gentle probing. And compared to when I first saw you, when I was doing the little probing around your gums, there's a marked improvement in how much bleeding there is. There's a lot less. So it's a case of regular hygiene is keeping the plaque away, keeping the bacteria away, and your mouth is going to become more and more healthy, and I think you're going to feel more and more confident about how it's all going.
My confidence has improved, but I do need to keep coming to see the team, and then hopefully we'll get to 100%.
Bad breath can be caused by systemic problems such as liver, kidney or lung infections, but the main cause of bad breath in 99% of cases is going to be gum disease.
So don't let bacteria use your mouth as a loo. Always brush twice a day for 2 minutes. Top tips: parsley can take away the smell of bad breath, and sugar-free chewing gum can stimulate saliva. A moist mouth is less smelly than a dry one. Stuart came to see us with a problem that's spiralling out of control.
And constant burning at the end of my penis, and I'm struggling to pass water.
After an examination, Dr. Pixie makes a diagnosis.
It may well be something like prostatitis, which is inflammation of the prostate gland. It can take months and months and months and months to treat.
Stuart is prepared to undergo a new cutting-edge treatment under general anaesthetic, which could relieve his problem. He's in the capable hands of Mr. Alan Docherty, consultant urologist who's a prostate specialist.
Prostatitis, which is what I think he has, is very common and forms quite a large part of our workload as urologists.
Prostatitis is the inflammation of the prostate, which is a gland beneath the bladder. Mr. Docherty inserts a telescopic camera into his urethra so he can see what's going on.
You can see there's the water pipe, okay? So that's the urethra, and we're going down his urethra, and this is where you'll see the beginning of the prostate. That's the muscle that keeps him dry just there. So we're going through the muscle that keeps him dry, and then if we look up here, that's his prostate. And it's interesting because all that fluffy tissue there is typical of prostatitis. So I think that sort of confirmed the diagnosis. Now we're in the bladder, and you can see there's the opening from the right kidney, there's the opening from the left kidney. I'm now going to do the prostatic massage bit of it.
Mr. Docherty lubricates his finger and inserts it into Stuart's anus.
There's the prostate there. You can see me, my finger can flick it up and down, so I'm in the right place. And now I'm going to just give it a good massage, giving that quite a firm massage. He wouldn't be able to tolerate this under. You can see some of the fluid coming out into the bladder there, that cloudy liquid. So I'm trying to empty all the nasty blocked juices. So it really should do it for a couple of minutes. Okay, that's probably enough. Now, when I pull this out, you can just collect some of the liquid that comes out. Ready? So we might be able to grow some bugs out of there. I like the fact we pretty much confirmed the diagnosis by what we saw there. And that's always nice to know what you're treating.
The hope is this massage should kickstart healing, but there are no guarantees.
It's a long time with this illness, and I just want my life back. I just want the normality that everybody takes for granted on a day-to-day basis. I haven't been able to, so I'm just hoping that I'm just on the road to recovery now. A little bit of luck.
Coming up, from scars to moles.
That's a cracker.
Spotting the danger signs before it's too late.
Notice change, because that will tell you that things possibly are going wrong.
And coming clean, 12 years of feeling self-conscious come to an end.
I think half the problem is that so many people don't know that I've got it, and the thought of them knowing is almost kind of too much to bear.
Coming up, will playing guinea pig change embarrassment into empowerment?
In a way, you're a bit of an experiment.
I've lived with it for this long, but if there's something out there that I haven't tried, then, you know, I'm all for it, definitely.
Can technology offer a chance to banish those blushes? And we're back at the airport, where there are some very red faces.
You're looking a little bit sore.
One day in the sun yesterday.
Whilst our doctors have been on the road, the most common complaints they've come across have been skin conditions, from stretched to flaky, cracked to spotty. Today it's Brendan whose trunk needs checking after the appearance of an embarrassing itchy rash.
Should we have a look?
Yeah.
Pop the shirt up there and we'll have a see.
If you stretch the skin there, Brendan, you can see that there's a little infection in the hair follicle, which is what we call folliculitis. And quite often it's caused by a bacteria that normally hangs out on your skin, but if it gets into a crack or a little pore, it can cause a spot or a boil or an abscess or other kinds of skin infection. Have there ever been times where you've actually shaved the hair on this area?
Sometimes.
What do you use?
Just a wee male groomer.
That's probably a factor, actually. What I would advise you to do is get some sterilising stuff that you can use to clean your trimmer.
Mm-hmm.
The second thing is a short course of antibiotics to just knock that infection and inflammation on the head.
On a foreign holiday, you can often come back with more than you bargained for.
It looks to me like you've been bitten. Right. And it looks to me like you've been bitten by bed bugs. Every day, take an antihistamine, and you can also get some antihistamine cream that you can bung on. Right. They'll calm down. People catch far worse things when they go on holidays.
And Helen has a spot of bother she wants Dr. Pixie to sort out.
Now, what can I do for you?
I've got a few moles on my back which seem to be hurting, but it's predominantly when I'm in the shower with the warm water as such on my back.
How long have they been there?
They've been there as long as I can know the moles as such, but the problem I would say has only been there 6 months.
Okay. And are you quite sensible about the sun? You take care in the sun?
Yeah.
You don't use sunbeds?
No.
No, good. Have you ever been badly sunburned?
No, not that I can ever remember.
And is there anyone in your family with skin cancer or has had skin cancer?
No.
Well, shall we have a look?
Yeah.
Do you want to, whatever's easiest, just pop up in the back there, maybe? Particularly this one?
Yeah, predominantly in the middle of my back.
Right. That is an absolutely, completely fine, benign mole. It's a nice colour and it's very, very uniform. There are no dark pigments in there, not irritated, not raised. We've got another safe looking mole there. Little one way down here at the back. They're absolutely fine.
Okay.
What I would say to you is it's obviously very difficult to keep an eye on them because they're on your back. So it's worth it any time you are at the doctor, if you're having your blood pressure taken or you're going for some other thing, just say, look, would you mind having a look at these?
Okay.
Are they all right?
Okay.
All right.
Thank you.
You're very welcome.
Sunburn on holiday can double the chances of changing ordinary moles into the most fatal kind of skin cancer. We're at arrivals at Birmingham Airport, where we're putting to shame the sinful sun seekers.
You're looking a little bit sore. What happened?
One day in the sun yesterday.
One day. Did you wear any sunscreen at all?
No, I got up. Wasn't intended to sit in the sun. Fell asleep.
You are really hot, aren't you? Is it very sore?
Sore, no.
No.
Boldly unrepentant, yet the statistics are stark.
Britain has more deaths from skin cancer than Australia, and this is actually likely to triple in the next 30 years unless we change our habits. Binge sunbathing can double your risk of fatal skin cancer.
Shock tactics are in order. We've brought a skin scanner to the airport that uses UV lamps to highlight areas of damage.
Pop your head in the curtain. There is some sun damage on the skin, which you can see that like the darkened areas to the skin.
Oh my god. I knew I'd burnt my face, but it just looks so blemished all over.
You could be permanently damaging the skin by sunbathing, and the skin is slightly looking like it's thickening slightly, which can sometimes be signs of the skin's getting older prematurely.
Will we ever learn?
I'm actually a beauty therapist, so I am aware of all this. But I do love the sun, and I've been away 6 times this year.
The best prevention against skin cancer is to limit the amount of sun you're exposed to. Always use a sunscreen and don't use a sunbed. The most important advice is check your moles. Thankfully for us, our embarrassing bodies lab rats are on hand. A fearless bunch of amateur actors have been demonstrating a number of health checks, and this week it's moles. On the surface, an ordinary mole and a cancerous mole may differ significantly, but it's up to a doctor. In this case, Dr. Priya and Dr. Christian to make that diagnosis.
Who has moles? There's nothing wrong with moles. They're normal. You can be born with lots of moles, or you can develop moles new. It's when moles start to go wrong that we, the doctors, get very worried.
The key is look for any change that's strange. Checking is as easy as ABC.
Does that look symmetrical to you?
First up, asymmetry. Is there a change in shape?
Is that a good thing or a bad thing?
Bad.
B is for border irregularity.
An irregular border is not a good thing either.
C is for colour variation.
If it's all one colour, that's a good thing.
Has it changed?
It's got dark bits in the middle, hasn't it?
And D is for diameter. Has it altered in size?
It shouldn't be anything bigger than 6 to 7 millimetres.
Notice change, because that will tell you that things possibly are going wrong. It's so important that actually you do check yourself for moles, or you get your partner to check yourself for moles. And if they're round on the back like that, where this poor guy has never seen before, you're not missing much, so you're not missing much. And if you say, actually, I do check my moles every 6 months, I know exactly what they're like, and I know this one's now different, we're going to listen to you, and we're going to take that even more seriously than we usually take you. Yeah? Do you all feel a little bit more in control of what you're looking for when you're looking at moles, yeah? Excellent, good stuff.
"25-year-old Caroline so cleverly hides her problem that no one knows it exists. She lives in fear of being found out. It's a condition that 2 million people suffer from in Britain, and most women dread."
Tell me, what can I do?
Well, hair loss. I've had it for a good 10 to 12 years, ongoing, on and off. At stages throughout that time, it's grown back completely, and other times it's been quite severe. Just seems like a kind of vicious cycle more than anything. I've tried various things, but nothing's really seemed to work.
Right, so what age did this start?
Around 12, 13, I think, if I can think back right. It's never been around my hairline at all, which I've been quite lucky about, so I can actually hide quite a lot of it really well.
And the patches that you had, have they now grown back, or are they still there?
It always grows back, which is encouraging, but it does take a while for that to happen.
How long?
Between, I would say, 6 months to a year.
I mean, because it's not visible now, how and why does it affect you?
I think half the problem is that so many people don't know that I've got it, and the thought of them knowing is almost kind of too much to bear.
What you're describing sounds very much like a condition called alopecia, which means a hair loss, and yours is alopecia areata, meaning you lose it in little individual areas. You can also get alopecia totalis, which means you lose all your head hair, or alopecia universalis, which is when everything comes out, and that means top to toe, every piece of hair comes out. I think best thing is I have a quick look just to see the extent of it, and then we can talk about...
I'm really surprised.
Am I? I mean, I can't see a thing. Give me a twirl. And also, I'm interested to see how well you managed to hide it.
Okay, so do you want me to take my hair extensions out?
Absolutely. Yeah, if that's going to make it easier.
No, it's fine. Take these clips out.
Golly, that's clever.
You see?
That's a very good match, isn't it?
So...
Right, I see exactly.
So it's literally all the back.
Yeah, it's all the crown of your head, isn't it? But as you say, you're very lucky because it doesn't really come into the hairline, does it?
Not at all.
Well, the skin is completely normal. Completely normal. There's not a rash, a flake, there's no redness, there's nothing. So it's healthy skin. Okay, that's fine.
Thank you.
It is alopecia areata. It's not going to turn into full-blown alopecia. And I'm also going to be brutally honest with you. There is no cure for this. We don't really understand it. We think it's a sort of autoimmune condition, so it's your body attacking its own hair follicles and making them fall out. We don't know why, we can't stop it, but what we can do is all sorts of different things for trying to help it. Steroids is a great one. And the other treatments are treatments that commonly you might have heard about for men who are balding. One in particular that you can rub on the scalp, it's called minoxidil, and it stimulates hair growth. And that's one I think we could try with you.
I've lived with it for this long, you know, and yeah, I have got used to it. But if there's something out there that I haven't tried, then, you know, I'm all for it, definitely.
Should we try that for you?
Most definitely.
And you, in a way, you're a bit of an experiment, but let's see. Okay. And if you like it, great. If you don't, well, you haven't lost anything, but you're as you are now, and you know that this works. All right?
Thank you very much.
It's a pleasure. There is no cure for alopecia, and I think Caroline realises this, which is why she has such a stoic approach. But there's no harm in trying other things that may just help thicken the hair a little bit and make her feel a bit more confident.
Lindsay has a large keloid scar on her chest. Dr. Pixie has referred her for a two-pronged procedure: steroid injections and laser therapy. She's come to see Dr. Gupta, an expert in scar tissue.
The keloid scar you've got is quite sort of hard.
Today he's injecting steroids directly under Lindsay's scar.
The response of it will still depend upon how much and how easily I can inject into it.
Although they don't make keloids disappear, steroid injections reduce their size by making them flatter.
Just checking I've covered the entire length of the scar. That's it for today, Lindsay.
Okay.
You obviously won't see much at the moment, but you wish to start seeing the result in about 2 weeks' time. The steroid went in very nicely and easily, which is normally a good sign, which means it's easier for it to break the scar tissue inside, and there wasn't much pain either. So I'm quite hopeful that one treatment should show a good improvement.
6 weeks later, she's back. Laser therapy will reduce the redness by shutting down the small blood vessels on the scar.
This particular laser is more like a heat energy which goes in and not only softens up the keloid scar tissue, but it also gets rid of these small tiny blood vessels which obviously make the scar look more redder compared to the surrounding skin. So what we're trying to achieve here is a flatter area where the skin color as close to the skin as possible. Looks good to me.
Are we done?
Yes, we're done.
It's only a week since her laser treatment and Lindsay's back to see Dr. Pixie. After years of being teased for her scar, has the wound started to heal?
Hi there, how are you? Nice to see you. Take a seat there, Lindsay.
Thank you.
Welcome back. How have you got on, tell me?
It does look a lot flatter. At the moment it's sort of still a bit swollen from the laser treatment, that's why it's sort of a bit discoloured. It's a bit easier because it feels a lot flatter, so I think it sort of blends in a little more with my normal skin.
Would you mind if I had a closer look?
No.
So that bit in the centre is still quite chunky, isn't it? But this is much, much flatter around here.
Yeah.
And even the edges are less, they've kind of blended in with your skin more, haven't they? But look, at least we've got more options in terms of there's still more treatment ahead, and you've got the option of trying some kind of camouflage makeup, which I think would work quite well. Thanks very much for coming back, and good luck with the rest of your treatment.
All right. Thank you very much.
The signs are promising. With a little camouflage makeup, Lindsay's scar will fade, hopefully to a distant memory.
Keloid scars are incredibly difficult to treat, so my advice is if you think you're getting one, go to your doctor straight away, because the outcome will be far more favourable.
Coming up, our doctor's routine self-test leaves even Dr. Pixie a little perplexed.
You see there, I've got quite a bit of blood in it, actually.
You do have a bit of blood, actually, yeah.
And will it work?
It's called minoxidil and it stimulates hair growth.
Can Caroline regain her confidence and her hair?
If I could get up in the morning and not have to worry about not having hair, it'd just feel like a massive weight had been lifted.
Caroline is back to the clinic. How has she found the results of Dr. Christian's experimental approach to hair loss? And will Kerry get any closer to finding out what's causing her problem? Our doctors have been demystifying simple tests they perform routinely in their surgeries.
I'm a really bad patient.
This week it's urine. A simple test isn't just a pregnancy indicator, it assists in the diagnosis of a wide range of diseases. Providing a decent sample isn't as easy as you think. You really have to make sure your genitals are scrupulously clean, as bacteria on the skin can contaminate the sterility of urine. Here's some our docs prepared earlier. A strip of special paper is dipped in the urine that will show if there are any abnormal products.
Urine may just be a simple waste product that you don't think twice about, but actually it gives us doctors loads of important information about how well your body is working.
So have a test of mine and see how I'm doing.
Years ago, when they didn't have urine sticks to check for blood sugar, physicians used to drink the urine.
Yes, I'm quite glad technology's moved on a little bit since then, really. That could have put me off medicine, I think. So these tests, I mean, these ones look for signs of infection, they look for signs of kidney problems.
You haven't got any blood in it, you haven't got any liver breakdown products.
And then we're looking for some sugar if I was diabetic.
You haven't got any protein in it, you haven't got any nitrites in it. No white blood cells, no red blood cells. It's good, that's clear.
And that's all as it should be.
That's all as it should be.
So your stick shows what? That's all right, all right, all right.
Yeah, but you see there, I've got quite a bit of blood in it, actually.
You do have a bit of blood, actually, yeah.
I think I'd quite like to send that off, actually, to check for infection.
Blood in the urine may be a sign of different diseases in the kidneys, the urinary system or the bladder. Her sample is sent for analysis. as Dr. Pixie stumbled upon a condition she didn't know about. 3 days later, she finds out.
In women, blood in the urine is not uncommon at certain times in the menstrual cycle. I was worried I might have an infection. I sent it off to the lab, and happily, I don't. In men, blood in the urine is always significant and warrants further investigation.
Kerry came to us with terrible anal pain and a problem emptying her bowels.
I'm not going to the toilet for sort of 12, 14 days at a time.
Really, that long?
Just because the muscles it just feels like I can't do anything, I can't.
So Dr. Christian sent her for tests to find out why.
Okay, Kerry, if you can breathe in.
Over a week, she's had to swallow a series of different shapes.
Breathe normally.
They're designed to show up on an X-ray so blockages can be found.
As you can see, all the shapes are gone, so I'm sure they'll regard this as a normal transit. Okay?
An MRI scan looks for tumours or congenitive defects. Maybe this will shine a light on the problem. Peter MacDonald, a gastrointestinal surgeon, explains.
The MRI is entirely normal, so at least we've ruled out tumours of the spine or things you're born with, like spina bifida and so on, which could just occasionally give chronic anal pain, which is, on the list you've given me, the worst of the features of all this. Now, all our tests have not shown anything to explain that physically. So therefore, we say you've got functional pain and functional change in your bowels. Now, that just says that structurally it's all normal.
Kerry is now sent to see Patricia Evans, a clinical specialist in bowel problems. She thinks that following childbirth, Kerry has been excessively contracting her internal pelvic floor muscles, which is making it difficult to poo.
I suspect that the pelvic pain you're suffering is because your pelvic floor is very tense. And if you look here, you can see where the pelvic floor is. And now, if that is very tense, it'll shorten and it will close off your back passage. So that's why you're having to strain, because you're having to use an enormous effort in order to empty out.
Okay.
And that to you now is normal. You perceive that action as normal. And what I have to do is teach you what is normal.
This, in medical terms, is called biofeedback.
Biofeedback, or behavioural therapy, is bowel retraining through a combination of education, lifestyle changes, and specific muscle exercises.
So how do we do that?
Normally, when you strain, you take a deep breath in and you pull your tummy muscles in and just push as far as you can. So what I've got to do is to teach you how to balance your abdominal muscles with your pelvic floor. And you will be able to empty your bowels with practice.
Okay.
Doesn't happen overnight, unfortunately.
Okay.
It's now 3 months since Kerry began her treatment.
I've had 4 biofeedback sessions now. It's definitely helping. I can go to the toilet more frequently, sort of once a week instead of once every 2 weeks. There's not much change with the pain, but it's only early days, so fingers crossed.
Until she spilt the beans to us, no one knew that Caroline was partially bald, apart from her close family and friends. She fooled everyone on the day that mattered most in her life with fairy tale locks.
Just looking at the pictures, even I can't believe how ordinary it looks.
But what happens at home when she bears all?
My husband is absolutely fantastic, and he tells me how beautiful I am every day. But it is a really personal thing for a woman to lose a hair. Even when I'm on my own with him, I still will try and keep my hair extensions in because I don't like him to see it. It just breaks my heart, and I know it doesn't bother him, but, it's just...
There is sadly no cure and no specific cause, but there are treatments such as minoxidil that can stimulate hair growth.
So I'm basically just rubbing the minoxidil into the areas that haven't got any hair. And I still use it on top of the hair that's regrown back as well. Hopefully it'll kind of promote that hair to grow a little bit quicker as well.
She sprays twice a day and it works by increasing the supply of blood and nutrients to the hair follicles.
If I could get up in the morning and not have to worry about not having hair, it'd just feel like a massive weight had been lifted. Hopefully one day, we'll see.
3 months have passed since Caroline's initial consultation and she's back to see Dr. Christian.
Caroline, we started you off on some minoxidil, didn't we, to try and make a change to your patches, and have you seen any difference?
I definitely think there's been a difference for me personally. After using it, the first couple of weeks I could almost tell a difference in some kind of stubble and regrowth straight away.
Okay, so you've noticed some new hair growth. Yeah. Usually with minoxidil, the hair that you get back is finer. You might notice it's not going to be like the nice brown hair that you've got. You know, it's going to be a finer hair, but it should be covering patches.
It definitely is.
It's doing what you wanted it to do. Can I have a look then? Yeah. There was a big patch at the back, wasn't there?
That's the main one, and it is starting to work in there, but obviously that is the most troublesome. But I mean, I do think that there's difference within that.
Well, this looks much better, I have to say. It's filled in a lot.
Yeah.
There's a lot more finer hairs that are growing. And actually what's nice is they are brown, which is good for you. And actually makes the hair extensions that you wear work better because there's less scalp to cover, isn't there, really?
Absolutely, yeah.
That's good. Are you happy with that?
I couldn't be happier. I really couldn't be happier, genuinely. I know it's going to be a long, slow process, but after how many years I've had it already, I'm more than happy to continue with the treatment and hopefully keep seeing results.
All right, well, listen, thank you for coming back to show me. It's nice to see you again.
Nice to see you. Thank you very much.